Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Hypothyroidism. Introduction. The thyroid is a gland in your neck. It makes important hormones for your body. Hypothyroidism is when your thyroid does not make enough of certain hormones. These are called thyroid hormones. Anyone can have hypothyroidism, but women and people over 60 have a greater risk. If it is not treated, it can cause many health problems. These include joint pain, obesity, infertility, and heart disease. This program will help you understand hypothyroidism. It will talk about its symptoms and causes. It will also explain risk factors, diagnosis, and treatment options for hypothyroidism. Anatomy of the thyroid gland. The thyroid is a gland in the front of your neck. It sits below your voice box, also called the larynx. A healthy thyroid is only a little larger than a quarter. The thyroid is shaped like a butterfly. It has two parts that are called lobes. The isthmus is a piece of tissue that separates the two lobes. The thyroid has many types of cells. They make several important hormones. Two of these are called thyroid hormones. The thyroid produces two thyroid hormones. These are called the T3 and T4 hormones. The T3 and T4 hormones affect blood pressure, body temperature, heart rate, weight. They are made by thyroid follicular cells. TSH stands for thyroid-stimulating-hormone. The pituitary gland in the brain makes TSH. It tells the thyroid gland to make more thyroid hormone when there isn't enough. Parathyroid glands are attached to the thyroid. There are 4 or more of these tiny glands. Parathyroid glands make parathyroid hormone. Parathyroid hormone is also important in keeping a healthy level of calcium in the body. Symptoms. Hypothyroidism has many symptoms. Symptoms of hypothyroidism often develop slowly. The most common are weight gain and feeling tired. Other symptoms of hypothyroidism include dry skin, enlarged goiter or enlarged thyroid gland, enlarged tongue, high cholesterol, puffy face, sensitivity to cold, sore throat. Symptoms of hypothyroidism also include depression, heavy or irregular periods, muscle aches or weakness, painful or swollen joints, poor memory, thinning hair. These symptoms often become more severe over time. Hypothyroidism is most common in women and adults over 60, but anyone can have it. Symptoms for babies with hypothyroidism can be different than symptoms for adults. They include choking, constipation, sleepiness, yellow eyes or skin, also called jaundice. It is important to treat hypothyroidism in babies early. If left untreated, hypothyroidism can cause physical and mental problems. Children and teens with hypothyroidism often have the same symptoms as adults, but their symptoms can also include delayed adult teeth, delayed puberty, slow physical and mental growth. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Complications. Hypothyroidism can cause complications if it is left untreated. You should talk to your healthcare provider if you have symptoms of hypothyroidism. Some complications of hypothyroidism include depression and poor mental functioning, heart problems from high cholesterol. Hypothyroidism can cause problems with pregnancy. It can increase the chance of miscarriage. It can also result in mental and physical disabilities in the baby. Hypothyroidism also can cause infertility. This means that you may not be able to get pregnant. Hypothyroidism can often lead to goiter. Goiter is when the thyroid gland becomes enlarged. It is usually not painful, but it can cause problems with breathing or swallowing. If it is left untreated for a long time, hypothyroidism can cause peripheral neuropathy. This means that the nerves that send information from your brain to your body become damaged. This can lead to weakness and poor muscle control. Hypothyroidism also can lead to myxedema. Myxedema is a severe form of hypothyroidism. It causes the body's functions to slow down to a dangerous rate. Myxedema is rare, but it is important to treat hypothyroidism early. Causes. The most common cause of hypothyroidism is called Hashimoto's thyroiditis. Hashimoto's thyroiditis is an autoimmune disease. This means that antibodies in your body slow down the thyroid's ability to make hormones. Other types of thyroiditis can also cause hyperthyroidism. These diseases include postpartum-thyroiditis, silent thyroiditis, subacute-thyroiditis. The pituitary gland is attached to a part of your brain. It helps your thyroid make hormones. A pituitary disorder can cause hypothyroidism. Hypothyroidism can also be inherited. This means that it can be passed from parent to child. Some medications can affect the thyroid gland. This can cause hypothyroidism. Some people have had all or part of the thyroid removed in surgery. This can often cause hypothyroidism. Iodine deficiency can cause hypothyroidism. This happens when the body does not get enough iodine through the food we eat. Iodine is an element that is needed to make thyroid hormones. Risk factors. Anyone can have hypothyroidism, but it is most common in women and adults older than 60. Hypothyroidism can be inherited. This means it can be passed from parent to child. People with autoimmune diseases are more likely to have hypothyroidism. People who have had thyroid surgery have a higher risk for hypothyroidism. Pregnancy can also cause hypothyroidism. Women who are pregnant or who have just had a baby have a higher risk for hypothyroidism. Turner syndrome is a genetic disorder that affects women. Women with Turner syndrome may be at risk for hypothyroidism. Diagnosis. Your healthcare provider will ask you about any symptoms you may have. He or she will perform a physical exam and ask you about your personal and family medical history. Hypothyroidism cannot be diagnosed based on symptoms alone. Your healthcare provider will perform a blood test. The blood test may check your levels of TSH, T3, and T4. Treatment. Healthcare providers treat hypothyroidism with medication. Your healthcare provider may have you take synthetic thyroxine. Synthetic thyroxine is a medication that acts like the T4 hormone. It may take time for your healthcare provider to decide which dose is right for you. You may need to take another blood test to make sure your medication is helping. Hypothyroidism can often be controlled with synthetic thyroxine, but you must take the right dose every day.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The thyroid is a gland in your neck. It makes important hormones for your body. Hypothyroidism is when your thyroid does not make enough of certain hormones. These are called thyroid hormones. Anyone can have hypothyroidism, but women and people over 60 have a greater risk. If it is not treated, it can cause many health problems. These include joint pain, obesity, infertility, and heart disease. The most common cause of hypothyroidism is called Hashimoto's thyroiditis. Hashimoto's thyroiditis is an autoimmune disease. This means that antibodies in your body slow down the thyroid's ability to make hormones. Healthcare providers treat hypothyroidism with medication. Your healthcare provider may have you take synthetic thyroxine. Synthetic thyroxine is a medication that acts like the T4 hormone. Hypothyroidism can often be controlled with medication, but you must take the right dose every day. It may take time for your healthcare provider to decide which dose is right for you. You may need to take another blood test to make sure your medication is helping. Thank you for using Explain.